More people are choosing BDS in 2026 than ever before. Dental colleges are filling faster, competition is rising, and everyone thinks dentistry is a safe backup. But it's actually growing or getting saturated. Let's talk about this. Number of dental graduates increasing every year. Clinics increasing, but patients not increasing at the same rate. Or I would say like population is increasing, but the awareness that people need treatment is not increasing the way it has to be. So that means one thing, competition is real, but at the same time, dentistry is also evolving, like cosmetic dentistry, smile designing, aligners, digital dentistry. Like these fields are fast, so it's not dying, it's changing. After 2026, dentistry will not be like just about having a degree, it will be about skills, personal branding, technology, and how different you are from others. See, the average dentist will struggle, but the smart dentist will grow. So, now the real question, should you take BDS in 2026? Hi, I'm Ishita, a dental student, and this is the most honest answer you'll hear. Look, BDS is not easy, it's not a backup plan, it's a full medical field. You study medicine, surgery, anatomy, pathology, and then actually treat patients. So, see, this is not theory, this is responsibility. It takes years to feel stable, and mentally, it can drain you if you are not sure about it. But here's the twist, BDS is not a bad choice. Like, it's a wrong choice for the wrong person. So, you need to see if you are the right person to choose BDS or not. If you are choosing BDS because MBBS nahi mila, parents said no, or like it looks easy, then guys don't choose this, you'll regret it. Okay, so if you ask me what is BDS, BDS stands for Bachelor's of Dental Surgery. So it's a 5-year course including 1 year of internship. But here's where people get it wrong. See, BDS is not just about studying teeth, it's medicine, surgery, and dentistry. And dentistry is not just theory, it's clinical work, practical work, working on real patients. And this right here is the factor that decides whether you should take BDS or not. So before you make this decision, watch this video till the end because one wrong assumption can cost you 5 years. So now let's break some of the biggest myths. First, see, BDS is not easier than MBBS. बहुत लोग सोचते हैं that MBBS is way more difficult than BDS. No, it's not. It's different but not easy. You are still studying medicine subjects and doing clinical work side by side. I know, see, if we look into the theory, there is less to study, but clinical work is a lot. And if you people think that after BDS you'll start earning quickly, no, that's not the scene. You have to gain so much experience because every person's case is different. You can't just study books and operate on patients. You need to develop good skills, and that alone takes a lot of time. And you know what, many people will say that BDS doesn't has much of scope, but you know what, once you get into the field and if you have very good clinical work, if you know your theory, you can earn in lakhs. See, if you look in today's scenario, people are so obsessed with aligners that alone costs a lot. So see, if you have good skills, if you have good businessmanship, you can earn quite a lot. But if you feel like you can't do business, some people don't have that thing, they are like more of job person type, then dentistry is not for you guys. I'm telling you, maybe some people would say that they can earn a lot in just job, but what I feel is that dentistry, if you think about it as a business, then yeah, but ethically it's a lot. But if you are thinking of just going for the jobs, then it's not a good field, you will get very less pay. If you compare it with other CS engineers and all, there's a lot of money they get by just jobs, but here jobs opportunities are very less. So consider this thing. And you know what, in dentistry you have to build your identity, be it in any way, because Patients will come to you only when they know about you. If you are not well recognized, if you don't have your identity, you can't just run your clinic. You have to make your identity your brand. So it's more like a business nowadays. If you want to earn good in dentistry, job alone cannot have that much money. If you're thinking about just the money, although if you go into research or if you go to abroad, there are more opportunities for the job basis. But if you want to earn good in India, then you have to think about your clinic, because that's the only thing which will help you earn more. One of the myths is that dentistry is just restricted to teeth cleaning, RCT extractions, and that's all. But you know what? If that's what you think, you have no idea what dentistry actually is. It's way beyond that. Now let's talk about something very practical: fees. Yes, private colleges can be expensive. But you know what? Not all private colleges have high fees. Some have comparatively lower fees, but then comes the trade off. Maybe the infrastructure is not that great. Maybe clinical exposure is less. But here's the truth: if you are determined, you can still make it work. You can learn theory in college and build your skills outside through clinics, practice, and experience. So it's not just about the college, it's about how you use your time there. Because what I've seen, if your college is affiliated by government, then the government colleges fees and private colleges fees are somewhat similar. Now, if you ask me what is the study pressure in BDS, look, BDS is not chill. You have to manage theory, practical work, clinical posting, and balancing all of this together. So, this is where most of the people struggle. And you know what? College life depends on one major factor: patient flow. If your college has good patient flow, you'll learn a lot. If not, you might struggle with clinical exposure. But you know what? Eventually, if you are doing MDS, so the clinical exposure at that point doesn't matter that much. Because if eventually you are doing MDS, you will have so much patient exposure. Is MDS necessary? You know what? It's becoming more common, almost like a next step, because competition is increasing. But is it the only way to succeed? No. I have seen people do well without MDS in this current scenario as well, through skills, clinics, non clinical work, research. So it's important, but it's not only path. And talking about scope, see, it is increasing, especially in urban areas. If you have right skills and you are willing to invest, there is huge potential, like more than people actually talk about. But it doesn't happen instantly, it takes time to build. So opening your own clinic sounds exciting, but reality is like you require so much investment, maybe in lakhs to crores. So equipment, setup, maintenance, and everything adds up. So before dreaming about your own clinic, be ready for responsibility that comes with it. And the war between BDS and MBBS, see, the difference of lifestyle is not as big as people think. Both require intense studying, clinical work, responsibility. And yes, BDS may have fewer emergency night duties, but that doesn't mean it's easy. In like MBS, theory is a lot. In BDS, it's not as much theory we have to study, but you know what? Clinical work takes a lot of energy. If you ask me personally, see, I always wanted to be a surgeon. That's why I chose BDS. And if you are interested in surgeries, you can consider BDS. There are days I feel overwhelmed. There are days I even question myself. But at the end of the day, this is something I can see myself doing. So if you are someone who relates to this, who likes working with hands, who wants to build something with skills, then maybe BDS can make sense to you. And you know what? I know the system isn't perfect. There are flaws, gaps, and things they don't make sense. And maybe you can spend years questioning it. But what if instead you focus on becoming as good that even those flaws don't stop you? See, because in the end, it's not just about the system you are in, it's about the person you become inside it. Yes, the system has problems, but your future is not decided by system. It's decided by what you choose to do despite it. But you know what I have noticed? In India, there is so much negativity around BDS. People constantly say no scope, too much competition, not worth it. And you know what? Maybe they are not completely wrong. Yes, there are drawbacks. Yes, competition is high. Yes, it's not easy. But here's what no one tells you: this is not just a dentistry problem. See, every field today has competition. Every field has struggle. Every field has people who are average and people who stand out. So the real difference is not the field, it's the person choosing it. Don't take dentistry if you are someone who wants easy money, wants a chill life, wants everything to be comfortable. But if you are like someone who wants to build something big, then choosing a field like BDS does something different to you. Like, it puts you in a position where you don't have shortcuts, and when you know there are no shortcuts, you either quit or you level up. Look, I'm not saying other fields are easy. Every field has its own struggle, but some paths give you early comfort, and sometimes comfort slows people down. And BDS is uncomfortable in the beginning, and that discomfort can either break you or build you. So don't ask, is BDS hard? Ask yourself, am I someone who can handle something hard and still win? And honestly, there are things you'll only understand once you step into this field. But no matter what you choose, just remember, every field has its struggle and every path has its own story. It's not about finding the easiest path, it's about becoming strong enough to walk a difficult one. And at the end of the day, your journey is yours to build. So choose wisely and own it. Don't forget to brush your teeth and stay blushed. I'll see you in my next video. Bye bye.